Castor?
Here.
Ross? I'm sorry, Ross?
Here.
Thank you. Lott? Lott? Snively?
Here. I think Rick Lott's
Thank you. You
back.
have a quorum.
Yeah, here. Yeah, I'm here. I'm back. This is Rick Lott.
Hello, sir. Thank you. You have a quorum.
Okay, Mr. Merrill on the meeting. Okay.
Yes,
We'll
I'm here.
make sure you're here. Thank you, sir. Good afternoon. We're now moving to public comment. We're allotted 20 minutes for public comment, 2 minutes per speaker. The first speaker is Kimberly Pullen.
Hi, good afternoon.
Yes, ma'am. Go ahead.
Can you hear me? Oh,
Yes,
thank you.
go ahead.
Thank you, Mr. Chairman. As stated, my name is Kimberly Pullen, and as a wife, mother, daughter, nurse, and lifetime Hillsborough County resident, I am reaching out again to ask this committee for assistance. My first call to this body was on May 7th. At that time, I expressed my concern regarding the lack of use of face coverings by essential workers and the general public. Fast forward approximately a month, and here we are now seeing consequences of our phased reopening as the number of cases and hospitalizations have begun to rise in our community. As I move around my community in grocery stores, other retail settings, it's fairly clear that the majority of business owners are following recommendations and requiring their staff to utilize face coverings while on duty. However, I continue to see 50 to 75% of the general public not utilizing any type of face covering, which is alarming to me, to say the least. As we continue to move forward in our efforts, surrounding economic recovery, reopening at both the state and local levels, my greatest fear is that our healthcare system is going to quickly become overwhelmed with the increase in new cases we're already seeing if we do not require the use of face coverings and other mitigating factors by the general public. Dr. Holt has stated in previous meetings that after a person is infected, they can be shedding the virus for 2 to 3 days before they even begin to show signs or symptoms. This provides a very long period of time for those infected to transmit the virus to others without even knowing they're doing so. So my main purpose of calling today is to, again, ask that the EPG provide guidance to our local business leaders, strongly urging them to not only require employees to wear face coverings, but additionally require patrons to wear face coverings to utilize their businesses, especially when appropriate.
Ms. Pullen,
Yes.
I appreciate your comments. I appreciate your comments. Truly do, but your 2 minutes are up. Thank you.
Okay, thank you very much, sir.
Thank you. Phil Murray.
Yeah, hi, this is Phil Murray. Can you hear me?
Yes, sir.
I want to first ask Dr. Holt if the antibody positives have been part of the new cases that we've been seeing, like other counties have been reporting in the state of Florida. I also want to point out that the idea of lockdowns and restrictions was not because of the increase in cases, but was for making sure that the healthcare system was not strained. And Dr. Holt and his colleagues have done a great job of showing that has not been the case. 3 Thursdays ago, we had 172 COVID-related hospitalizations. This past Thursday, we're down to 142. And he said, quote, we had very few ICU cases. I think this needs to be part of the narrative that's taken into account for both the EPG, the general public, and honestly, even more so the media to get that information out there. Thank you.
Alicia Legg.
Hi, I'm Alicia Legg, and I understand that everything is a process. However, many top scientists have said that this virus dies in 80-degree weather, and it's also been 80 degrees for several weeks with high humidity. They also have said that children are not as affected by this virus, and there's no evidence of transmission from child to an adult. Also, bars, restaurants, and beaches are open. Walmart and big box stores are open and have been open, where hundreds of people can shop. Thousands are protesting and rioting, yet our children can't enjoy outside playtime at a playground after being taken away from their schools and friends for over the past 3 months. The mental and physical health of our children, especially those with special needs, are just as important as recreational fun of those adults that want to hang out at bars with their friends and those exercising their rights to protest. Being outside in the open air and in the sunlight is, and being able to play is good for mental health. It's also good for the immune system. So I would really greatly appreciate it if you all would just open playgrounds. Other counties are open, so why can't ours be? Our children have suffered long enough. I'm frankly tired of being told what I can and can't do with my children by elected officials, and I'm tired of asking for permission, that which I don't need, but I'm doing as a courtesy. Your job is to protect my rights, not my health. That's my personal responsibility. I am an adult, and I'm very capable of assessing risks and deciding for myself and my family if I want to take those risks or not. The immune system response of others is not my responsibility. We need to open our county without restrictions because we are not children needing to be told what to do. We are free-thinking American citizens. Wear a mask, don't wear a mask, social distance, don't open your business, don't. It needs to be our choice, not an unlawful, unconstitutional government mandate. Thank you so much for your time.
Cheryl Golden.
Yeah, this is Cheryl Golden. A couple of points. I think the situation when we're seeing the uptick, the study from USF, we expect to see an uptick. When someone wearing a mask affects me, I would appreciate and hope that there's recommendations that people within restaurants, people who go to restaurants are wearing masks. We also saw recently where the meat market in Hyde Park sent out a note because they had a COVID-19 person there. You know, what's the restaurant's responsibility to let people know, and what do they have to do to reopen? Secondly, quickly, how many tracers do we have? Are they keeping up? And thirdly, is there a website that you can put together that shows the diagnostic test by location or which facility, how long the results take, the reliability, and the type of test? Those things are all hard to find. And lastly, if I can protect someone else or someone else, what they do affects me, then I think we all have a right to ask for masks. Thank you.
Thank you. Carrie Cloyd.
Yes, Mr. Chair. Can you hear me?
Yes, sir.
Yes, Mr. Chair. Good afternoon to you and members of the Emergency Policy Group, Gary Cloyd here in Tampa, Florida. You've had many challenges going back to March. Between now and June 29th, I would request that the county attorney review some of the suggestions that the Florida Task Force that gave their recommendations to Governor DeSantis, particularly on page 7 and 8, as it relates to the prediction of upcoming possibilities of COVID-19 related issues. The first week of July in particular, page 7 and 8 details a lot of things of what could happen and what things are put in place if the increase would happen. And keep in mind that the individual rights of people should be taken into consideration, as well as looking at the economic recovery part of it. This task force was given a strong mission, and I would ask again that the county attorney look at that for clarification and that we look at everything before making any decisions before the first week of July. Thank you.
Thank you. Mr. Brewer, did Dane Zimmering call in?
No, sir.
Okay, thank you very much. That closes our public comment section. Emergency management update. Mr. Dudley, good afternoon.
Good afternoon. All right, we should be loading here. All right, we continue to support home testing and operations of 7 remote collection sites. This morning, we had 2 additional sites open up in Wimauma and Sun City. You can visit hcflgov.net/stay-safe to take a look at all 7 sites, and locations and address will be provided on that website. Last week, we had 3,190 tests conducted. Total testing since operation began, 28,263. We had 3,353 appointments scheduled for last week. Also, we have 1,447 appointments scheduled for this week. And we continue to take appointments throughout the day and all throughout the week from 8 to 5. And you can schedule any of those appointments at 813-272-5900. There's no insurance or any doctor's note required. Please visit our testing sites. Logistics. We have a total of 6,648 testing kits on hand to support operations. We've had over 2,300 requests filed with the state. They continue to fill those requests, focusing on PPE supplies. We've had a uptick in distribution of masks, face shields, gowns, and goggles. No change in donations for this week. We have 1 guest at our quarantine site and 21 guests at our isolation sites. And the task force continue to work hard in testing our most vulnerable population in our long-term facilities. That concludes my update. Any questions?
Hold on. I don't see any questions, sir. Yes, I do. I'm sorry. Ms. Snively, recognized. Excuse me.
Thank you, Chair. First, I want to thank Suncoast Community Healthcare Systems one more time for opening that location, but also having the after hours availability for folks that can't make it to a testing site during the day. I did have a couple of questions of curiosity. If someone tests multiple times, let's say a person has gone to a testing site and had their test 3 times, and 3 times they were positive, or 2 times positive and once negative. How does that count in the statistics? Is that one person, one test, one case, one person, or does that show up as if 3 people came and tested and there are 2 positive cases and 1 negative case? How does that count when one person gets multiple testing?
I would have to refer to Dr. Holt on those numbers to see how we count that up against the statistics.
Okay. And then I have another question, but I'll save it for Dr. Holt because it's related to testing. But thank you.
Okay, Mr. Dudley, thank you very much. Appreciate it.
Thank you.
Dr. Holt, public health update.
Yes, good afternoon. This is Dr. Holt, Florida Department of Health, Hillsborough County. Let me begin by answering Ms. Snively's question. It's a great question. No, ma'am. Once a person is tested, we only count their first test positive with our PCR test as a case. So there are situations where people get tested after the fact. Multiple times can be positive, but they are only counted once for our statistics. Also, a caller had a question regarding the antibody test. This test is also not deemed to be diagnostic. Therefore, it is not included. So positive antibody tests are not included in the positive results that are reported on the state website on the daily reports. So I don't know, Ms. Snively, if you had any other questions about that, but I'll finish my report and happily answer all your questions. Today, I'm going to focus on the numbers. Provide my overview and takeaways. Then with Mr. Wagner, we'll present the slides. It's been a short period of time, but we continue to see some similar trends. As of yesterday, as you'll see, there are reported 3,612 cases. That's an increase of 438 from where we were 3 days ago, which is an average of about 146 per day. Our long-term care for this same period of time represents a decreasing number and many of them associated with a mixture of staff and residents, again, associated with some of the positive testing for those facilities. We've now tested approximately very nearly 6% of our population. As you'll see, the age, if you look at cumulative, we're continuing to see that shift of our curve towards the left, where we see increasing percentages of our cases being shown in those ages for those less than 34. You'll see that same slide as our 14-day average. And again, if you look at it closely, our biggest increases was in the 25 to 34-year-old. We will be presenting race and ethnicity on a weekly basis, so we'll include that. And we're also working to look at our zip code data for our Thursday report. Our 14-day case trajectory shows continued steady increases. There was a slight flattening of yesterday, but early reports today, I anticipate a large number coming back. Our number of tests, we continue to show a steady increase up to almost 1,800 a day. That is nearly 80% of our target of 2,250. The 14-day positive trajectory similarly has a steady increase. We now, for our 14-day average, are just above 5%. And you can see for our last 4 days, we have seen some peaks, one as high as 10%. Our deaths, we changed the way we presented this a little bit to be more consistent with our rolling average. And again, I think it shows what has been very obvious. We've seen a significant reduction in our deaths associated with this COVID outbreak. The hospitalizations essentially are unchanged. The total number of hospitalizations as of 6/12 is 138, and the total number of beds available, 22%. ICUs, we had 34. They're a little tighter. There's 4% availability, and our ventilator is 17 COVID patients with 80% availability. I typically get asked again 2 questions. The first one is always, what is our trigger? And there really isn't an exact science. There's no absolute. The hospital pressure that we've been referring to is certainly an obvious one, but it is a late and somewhat reactive. I continue to look at it from a composite basis, and therefore you'll see some mixed. There's some concerns, and then there's some reassuring. Currently, I don't believe we certainly need to retreat, but we need to continue to get some of our cooperation. It's not about shutting us down or because I just can't accept that our community won't pull together and reduce this transmission. We do see evidence of this community-based transmission and supported by the number of cases that we're seeing, the uptick, and some of the epi. And associated with that, my second question is Mayor Lott's always asking me about the case investigation and contact tracing. Again, over the past week, we don't see any smoking gun to say this increase that we're seeing is tied to either specific locations or even activities associated with the reopening. We continue to see about that 1/3 reporting fairly confidently that they know they were infected either in their households, extended family, some friends, or workplaces. As far as entertainment or retail, while we have had worker reports, no patrons that we can associate with any facility. And with that, I'll stop there, ask Mr. Wagner to go through his slides and then be available for questions.
Thank you, Mr. Chairman. Can you see the slide presentation?
Yes, sir.
Great, thank you. Again, Kevin Wagner, Business Analyst for the Healthcare Services Department of Hillsborough County. The information will accompany Dr. Holt's presentation, again, dated as of 6/14 on the 10 a.m. FDOH report that's publicly produced. As indicated, there were 3,612 individuals who tested positive in Hillsborough County. The majority of those were Florida residents, while a small de minimis percentage were non-Florida residents, but by and large, they were Hillsborough County residents tested positive. We've tested nearly 6% of the population. Again, it can account for duplicates or individuals being retested on a negative basis, but total test equates to almost 6% of the population. And again, the male-female split on this is 54% female, 46% male of the positives. As indicated on the age breakdown, the 25 to 34 has adjusted the bell curve to really be the highest percentage. Nearly 20% of the aggregate cases are positive in that age range. Again, the other age range with the largest is 35 to 44, and 45 to 54. But as we've seen in the last few days, the uptake is in the 25 to 34 age range. Adjusting back with 14-day counts from June 14th, the yellow bar on the under 14 years of age on the yellow bar, June 14th was 7.5% of all the positives. On 15 to 24, 16%, nearly 17% were positives, and the 25 to 34 were 26%. Those three categories in the rolling 2-week period accounted for 50% of the case positives. The other age, and again, 35 to 44, 45 to 54, 55 to 64 have seen a slight flattening or a decrease in positives. And then the individuals above 65 years of age, again, we see a major decrease of that, the shifting from the individuals over 65 to the individuals 34 and under. Cases per day, again, this is on June 14th. The June 15th number is, again, quite as high, but the rolling trajectory of that was over 100 cases a day on the 14-day average. Again, the yellow items in yellow. We've also indicated the phase 2 reopening on June 5th as a red mark as requested by Ms. Wise, just to show where the incline is. But again, on the 14-day rolling average, we're nearly 100 cases a day. As indicated on our testing, that is trending upward to nearly a little over 1,800 a day, trying to meet that goal of 2,250. The 1,800 are the test results received today, not the total number of tests, but these are the results received in by the FDOH on their daily reports. The positivity, again, on the 14-day, on the green portion, at the end of June 14th was nearly 5.7% of positivity on a rolling 14-day average. So as Mr. Merrill indicated last time we spoke on Thursday, that arrow is trending upward. But again, let me be fair. I've adjusted this slide to just go back to May 1st, because that's really the reopening of the states. So again, that trending from May 1st is the upward slope. The Hillsborough County deaths per day, again, Dr. Holt indicated we just want to show this differently to give the members a complete picture from the beginning of when we were collecting this data in the end of March to June 13th. We see a downward trend in the number of deaths that have indicated a slight peak in the middle of April, but again, overall, it's been a pretty flat or declining trend for deaths indicated. Hospitalizations, I'll go through these. On the top left-hand side, on the far right column of the top left-hand side is June 12th. There are generally 4,400 beds a day, beds in the hospital system. On average, 22 to 25% are vacant. That day, there was 985, 3,400 were being used. When we carry that 3,400 beds being used on June 12th over to the top right-hand chart on the far right column, 3,400 beds being used, 138 or about 4% were COVID hospitalized. The remaining 3,200 for elective surgery or various other reasons. But again, 4% were COVID hospitalized. Bottom left-hand side on the ICU bed summary, again on June 12th, 34, about 9% of all the total ICU beds. I ran the average on the days indicated. It's around 32, nearly 33 individuals on this time frame that are in the ICU. Vent utilization, the last one on the bottom right. This is one that I want to keep an eye on. As you see on June 12th, there were 17 with COVID on vent. On June 10th, 16, and June 8th, 11. So I want to see if this trend continues or flattens from a vent utilization standpoint for the individuals on COVID. But by and large, COVID makes up less than 3% of the individuals on vent. But this is something we'll continue to monitor. And I'll stop there. Thank you.
Thank you. Dr. Holt, anything further before I get into questions?
No, sir. That concludes our formal presentation.
Okay, very good. Mayor Ross, you recognize.
Thank you, Commissioner. Dr. Holt, I have two questions. One is, of the hospitalizations you've spoken in the past, some of them in the past anyway were preemptive or proactive hospitalizations from some of the long-term care facilities. And my first question is, that's still the case? And if so, about how many of those are those cases? And my second question is, now that it's been over 2 weeks since the protests really started, in your contact tracing, have you been able to tie any of these cases back to those protests, or is that an urban legend that we've all wondered about? And I think there's a lot of curiosity about that. So those are my two questions, Doctor. Thank you.
Yes, sir. Thank you. First, the admissions that are proactively coming from our long-term care facilities, they have dramatically reduced. I think, as I mentioned, I think we had 25 identified cases in long-term care, which about half of them were staff, which aren't admitted, and the residents. So we probably had about 10 during that week. That's a reasonable estimate, not an exact. The emergency rooms, talking with the hospitals and others, they are seeing more in their emergency rooms of the younger people, and a larger percentage of their admissions are coming from what they call the community. But again, many of them are short-term hospitalization, and that's why we're seeing the numbers of total admissions or total people in the hospital aren't changing, but they are seeing increasing admissions, but that's associated with discharges. The second question had to do, have we been able to link any specific case or group of cases to protest or any other type of group activity? And at this time, we have not. We do ask generally, kind of, have people been around large groups of people for whatever reason? We're not specifically asking about the gatherings regarding our protesting, but any gathering, and that hasn't been a common response at this time that we picked up on, sir. I'll stop there.
Okay, thank you, Doctor.
We lose chair.
Yes, ma'am. We did lose Chairman Miller there. He's still on the line, but I'm getting a low bandwidth error from his session. Does the vice chair want to take over the meeting?
I will until he returns. Because I'm unable to see who has their hand raised, Okay.
I will be sending that. I'll be sending that permission to you in just a second here.
Okay. For the lack of a cue, I'm going to go recognize Mayor Lott.
Thank you, Vice Chair. I had my virtual hand up and my actual hand up, so I'm glad I was recognized. Thank you very much. I have a question for, I think, Dr. Holt. I think all of us know individuals that have been positive with COVID-19, but from the beginning till now, it sure seems like a whole different strand of COVID-19, just from a layman's terms, because the individuals we're seeing, or that I personally know that have it now, aren't experiencing the elephant on the chest, so to speak, the hard breathing. It's almost like it's a bad sinus or a very light flu symptoms. Dr. Holt, is there a shift in the COVID-19 that we're experiencing? Is it weakening? Is it or is the symptoms starting to change a little bit?
Yes, sir. That's a great question, and it is being asked quite a bit. And even in the science, it is a part of a lot of the looking at genetically. Can you break it down? And viruses naturally mutate. The coronavirus, as I've mentioned before, is comparatively has a low mutation rate, at least based on past experiences with this class of viruses. Certainly, and we should be thankful for that, because of makes the likelihood of a vaccine much more realistic. There is nothing so far that anyone has associated with the genetic changes, and they're associated with those changes would be some type of propensity to be less contagious, more contagious, less severe, certainly not more severe. So there really hasn't been a lot of changes. One thing I would make just as a simple observation, and again, not factual, is that the people that nowadays, and I think it's a great thing, are getting tested for a variety of symptoms. And I certainly have had that personal experience as well when I talk to people. Little things that previously that probably would have not considered, allergies, sinuses, and things like that have precipitated a test. And fortunately, through the effort of Mr. Dudley and the others, we do have widespread availability to testing. So to answer your question, no, there's no science to suggest it. I agree with your observation that people, the reports are people who are less severe than what we saw originally. Certainly, taking into account for the demographics, if you just look at the age, that is a consistent observation, but there's no explanation that I can tell you based on mutations of the virus. And I'll stop there.
Another question, if you don't mind.
You're recognized.
My personal experiences seems to go along with the data we're looking at. You know, earlier on, everyone I knew of that had COVID-19 were in the higher age groups, and now every single one I know that has it is in that same age group that we're looking at now, where we're seeing the spike. So obviously, personally, it looks like that trend. We can all verify that as everyone's getting out more social and going back to work. But I want to get back to the contact tracing. I know that I asked you about it a lot, and I'm fascinated with it. But my understanding was that this, as we opened our economy back up, that the contact tracing was allowing us to recognize the hotspot, and then instead of having to put rules over an entire county or an entire area, that we could then have our teams that have been built during this particular COVID-19 era attack those hotspots and put them out. Now, is that still the case, or has that changed?
Yes, sure. That was the design, that was the intention, and as we have encountered with COVID is that it tends to not cooperate. It moves fast. We were trending down. We had a sustainable reduction, and we had a caseload that would allow us to more promptly and directly respond to places to things that are not associated with community-based transmission. But once you start to see large and more community-based transmission, then the value of contact tracing is reduced. The challenges you have is you have a large number of people that were probably exposed, but based on the lack of awareness of where they were exposed or who they've been around, you're very focused to just on the household and some others. Increasingly, we have also encountering challenges for people to comply with voluntary quarantine, whether it needs to go to work and some others. So it's a multitude of factors that are preventing us from achieving the ideal goal that was promised under that contact tracing. So the circumstances have changed as far as the amount of virus that we've seen in the community, and again, the difficulty in getting people to understandably self-quarantine for 10 to 14 days when they feel fine. I'll stop there.
So, Dr. Holt, I do want to brag on a little bit. I noticed that the testing sites that we're providing out there, we went from the results coming back in 10 days to about 5 to 6 days. And it seems like in the last week, the individuals I know are getting the results back in about 48 to 36 hours, which is phenomenal. So, whatever you've done there to improve that, congratulations. One last comment I'd like to make here is that I know that I guess I'm not surprised that the numbers are increasing, because they have to increase if we open up the economy back up. The more we socialize, the more we get out and work, and the more we, become non-isolated, the numbers have to go up. So I guess I'm not surprised at that. I expected that. Okay. I was actually expecting it to be probably a little more than it has been so far. So to me, I'm a little bit relieved. But when I look at the numbers and the deaths that we have, Dr. Holt, can you explain that a little bit? I mean, we peaked I think it was around April 21st, and then now it's down to, 3, almost 0 to 3. Is there a particular reason for that, or is it just because the percentages in that age category is reducing?
Yes, sir. And just before I want to give, as far as the testing, I want to give to my partners and Mr. Dudley, Gene Early, Mr. Merrill. They've been fantastic with being responsive to the testing, and they've taken they made local decisions that have avoided some of the delays, so that they get the credit for that. And I share your appreciation. As it relates to the deaths, it's generally a combination of two things. The early phases that we had, we were recognizing the illness late, and particularly in the elderly, because we were focusing on our testing there. And so talking with the hospitals, and again, Dr. Devers sort of gave us an outline. She used to see a lot of deaths that were coming from sometimes late presentations to the hospitals and others. So I think we're seeing some proactive identification of some of our people earlier, if you will, and even including the elderly. And the other thing I would pay attention, or at least acknowledge, is that our elderly are, if anybody has the least amount of freedom, it's them. They're not out and about because of their concerns. So I don't think the exposure degree that we saw early on is occurring because of the actions that they are taking to protect themselves. And the secondary aspect, you can see it with the ventilator drop, is the hospitals and the medical science have learned a remarkable amount in a short period of time about how to much more effectively treat people, including some of the new drugs. So some of the patients that were coming in and requiring a lot of medical care are doing much better. We were fortunate all along that we didn't see the younger deaths, but talking to my colleagues, there was a lot of very ill people who are in the younger ages, and they feel they're much more effective at supporting them and treating the illness. And so I'll stop there.
In closing comment, Madam Chair, if you don't mind, I think sometimes we just have to really, compliment our citizens and our business community, because they really have responded. If we remember when the second meeting the APG got together, we had a model that was presented to us that told us by the third week of April, most likely our medical facilities would be overrun, and that didn't occur. So I think it was great decisions made by this board, great actions taken by our business community and our citizens, and that didn't occur. We were then presented another model that said by Father's Day that there's a good chance that our medical facilities would be overrun. And obviously that's this Sunday, and we look at the numbers right now, that's not occurred as well. So, I think we're getting great data, great information, and I think you can always do things a little bit differently, but better. But the decisions made and the response from our business community and our citizens obviously has proved those two models wrong so far. So hopefully going forward, we continue to have the same great results. And I think all of us would agree that going from that second meeting in the world was coming to an end, we all would have prayed and said thanks for the results we have so far. Thank you, Madam Chair.
Thank you, Mayor Lott.
Commissioner Overman?
Yes.
Yes, it's Terry McElroy, Director of Communications. Commissioner Miller is having problems with his internet. He's trying to get that resolved. He said, please carry on. He apologizes for his issues, but he'll try to get back on when he can.
Great. Thank you very much, Kevin. I appreciate that. I do have a couple of questions, but before I go, now that I'm wearing the sort of interim chair hat, did anyone else have their hands raised? I'm not sure I can see that. If you do have your hand raised, could you wave your hand? Like, wave your hand? Okay, so I actually, not seeing any further questions from the group members. I do have a couple of questions for Dr. Holt, as well as Mr. Wagner, who puts together the numbers. On slide 5, you have an excellent presentation indicating sort of the trend that we've seen consistently as it is increased, not taking into consider age, but consider the number of individuals on a daily basis that test positive on average. And in today's presentation, you show that the 14-day rolling average was 100 cases a day. If we look at where we've come, which to Mayor Lott's comments, we were seeing on June 3rd, we were seeing 48 cases a day. And prior to that, we were seeing in the in the 20s. We actually in the 20s to 25 a day. So while we have done a marvelous job early on of reducing exposure, and that was a large part of not having businesses open yet, where people weren't out and about, and they were staying home, so they weren't able to, around a lot of folks. So contact tracing was easier. We now have a lot of folks out working and interfacing with people in their businesses and in their community. And our numbers have doubled in the last 2 weeks on average for the rolling 14-day average. I recognize that is disconcerting for many, and it's not a big surprise because people are out and about doing business. But I think what is important, while we haven't overrun our hospitals, if we have 138 beds and we double again, and even though it's in a younger age range that's exhibiting it, and speaking with some of the medical facilities, the folks that are in the hospital now are really sick, and they are young. And they oftentimes, if they're hospitalized, they end up staying sick for not only the time that they're there, but for long periods of time. Dr. Holt, you had told us at one point in time they get sick for a very long period of time. And that's what I'm concerned about. I know we have excellent medical facilities, and I know we have a lot of beds. But if we continue to see an increase in the daily test positives, which means some portion of those folks will be in the hospital and they stay for a long period of time, we're going to have a problem where where people not recognizing their part in actually protecting each other becomes problematic. Where if you go into a business that's inside and you don't have a mask on, you're going to run the risk of infecting someone because you don't have, you don't know you have it for several days before you ever exhibit any symptoms. Is it correct that you can have someone's temperature checked at a door and they be positive, even though they may not have a fever, Dr. Holt?
Yes, to the last question, absolutely. As we mentioned, I think talked about last time, once you get infected, after exposure to someone, whether you get sick or not, you're infectious for about 20 days. Peaks about 2 to 3 days before those that have symptoms develop symptoms and lasts for 2 or 3 days after that. But that's the peak. So yes, anyone who is either what we call pre-symptomatic but infected, or ultimately never develops a symptom, a portion of those will have normalized temperatures for that period of time. So temperatures are a very good screening tool, but they certainly don't catch all. And I'll stop there.
Okay, so that makes my next point. Because we've seen a quadrupling of children infections, as well as the ages between 15 and 34, it's likely that those individuals are not showing symptoms, not aware they have symptoms, and are out and about in the community among those that are not wearing face coverings. Is that a safe assumption?
Yeah, and I think as we've had presentations by Dr. Emanuel, children are a source of a lot of uncertainty in science of COVID. They certainly can get infected, although they do seem to have a little bit more resistance to that possibility. And certainly they are less likely to get sick, and of course, particularly in certain ages, very difficult to social distance or wear masking. So I think, as you sort of surmise, yes, the children can have some of those features, if you will, has the possibility for them to be a source of infections, although that hasn't really been documented anywhere. But I agree with all this, surmises.
No, the reason I ask is because I do believe, and I'd love to see if, when we get our report on Thursday, the survey results of our citizens, but I'd be very curious to see what the age spread is on those that are still self-isolating or self-quarantining and not out and about. So if the reason we're seeing an increase in test results, positive test results in the younger ages is because that's the majority of the people that are out and about, versus, generally all the age ranges are out and about, and we're seeing a higher incidence of infection at the younger ages and not at the older ages. you know, that is going to be an important piece of information to give us guidance on how critically important all of our methods of containing this are going to occur. So the ages between 35 and 64, I'm curious if those individuals on a majority case in Hillsborough County are still staying home, still not out socializing, wearing face coverings to protect themselves and others, as opposed to the younger ages. So I'm looking forward to Ms. Lopez's results. But I think that's critically important that we talk with the younger age ranges to help them understand that they've got to protect not only themselves, but also those individuals who decide to start venturing out as our economy continues to open. Because clearly we're not going to shut businesses back down. We've got to figure out how to address the spread that we're seeing that has doubled in the last couple of 3 weeks. So thank you, and I'll stop there. Chair, I see you returned.
I know some of y'all hate it, but I'm back.
No, I'm glad to see you back. Thank you very much.
Okay, where were we? Where are we here?
Dr. Holt is answering questions, and I was asking the last question because I didn't see any other hands up, but it does look
Well, I see Miss Snively, Miss Merman. Have they been called on?
No.
Okay, Miss Snively, you recognize.
Thank you, Chair Miller, and welcome back.
Thank you.
All very good points, Commissioner Overman, because, you know, we are concerned about hospital capacity. I think it's really important that we're drilling down some of those numbers so that we can, you know, project the rate that hospitals are being used for as far as capacity goes. I had a question about, you talked about the average stay in hospital is a long time, and I'm curious to know, are we tracking what that average stay in a hospital is? Is it 3 days? Is it 5 days? Is it 10 days? And are we tracking that even more importantly by age range? So is it, you know, are the one age group, the 25 to 34 age group, are they staying in the hospital for an average of 3 days, or are they staying in the hospital for an average of 14 days? I mean, it's really important for us to know that in order to project hospital capacity and any concerns that we're going to have or any action that we're going to have to take as a group if we are not drilling some of that information down. So what's the average stay, and are we drilling it down by age range? Thank you.
This is Dr. Holt. The data we get for all is self-reported from the hospitals, and it's required by AHCA. And so we get the data that we share, the number of people who are currently hospitalized, the number of hospitalized, admitted in a day, the number discharged, total number in the hospital, total number in the ICU, and the total number of on ventilators. I agree with your question or comments that the information regarding some of that length of stay is valuable, and we work, and I speak with the hospital groups regularly, probably twice a week or more. I can make that request for some feedback and information. If it's readily available, I suspect they will share it, but it would be up to them. But I can certainly make the ask on our behalf. I'll stop there.
May I be recognized?
Sure.
Once more, Chair.
Follow
Thank you.
up. Yes.
So thank you, Dr. Holt, for that, because I do think that's very valuable information. It's really critical information to know or to be able to project that. And so if you could request that information from our partners, that could be very helpful in drilling down some of the average stays and the hospital capacity information that we're going to need to be able to make some decisions moving forward. But thank you very much for your response, and I hope that they're able to share that information with us. Thank you.
Commissioner Merman, you recognize.
Thank you, Mr. Chair. Glad you're back. Dr. Holt, always thank you for all your information. It's so helpful, especially with, you know, any direction this board may have to take. I just want to ask a quick question, because I do see the number of ICU beds is less, and the percent of, or the number of available beds in the hospitals is less, and it seems like it's going down. At what point, I'm not going to ask you what the trigger is anymore. I'm just going to say, like, from this hospital information, when do you get concerned? At what number do you get concerned? When it's 0 or something more than that?
Yes, ma'am. And thank you again for the great questions. We, again, led by Gene Early and Mike Merrill and others, we have a hospital weekly or call with the hospitals. So it's called a surge group or surge committee. And on Friday, we spent a considerable amount of time trying to drill down and find out just some other type of metrics that might give us a little more earlier sense of what their stress points were. And I think I mentioned this last time, and this is what I heard from them, is that they have a very dynamic ability to expand ICU capacity as necessary. And in fact, they wouldn't even sometimes characterize this as a particularly unusual circumstance, these types of getting down to where there appears to be very small numbers of beds immediately available. And so we've talked about trying to find some additional information that I think would be perhaps more insightful. And they agreed to work with us to help us better understand and how to convey their situation. But they really tried to reassure us even Friday that right now they're okay as it relates to the COVID, and the biggest impact is they're getting back to business. So I'll stop there.
Thank you very much. I do think people have gotten complacent because there's no sense of urgency, like hospitals, deaths, things like that. But I do think people are paying attention to the numbers. They just aren't seeing much of a change. So they think they can just go about their business. The zip code information, that will be on Thursday? Is
yes,
that going to be available on Thursday? Okay.
Yes, that's our, yes.
Okay, I think that's going to be real helpful to us. We can find out where all the activity is. Then you can start targeting and micro-targeting a lot of communication into those areas and maybe help curtail some of the spread of the virus. Thank you.
Okay. Mr. Merrill, you recognize.
Thanks, Chair. I just want to add one thing to Dr. Holt's comments. We're adding another 60 beds of at our step-down facility at University Village. And that should be in place probably this week. The reason why that's important is it creates another safety valve for hospitals to be able to move people who don't necessarily need to be in the hospital, but they still need a level of care, and especially those who are coming from long-term care facilities. So creating an additional 60-bed capacity will also provide some relief to hospitals and some additional capacity.
Okay. Mayor Lott, you recognize.
This is a quick one. Dr. Holt, the zip code information we're going to review on Thursday, are we reviewing the numbers by zip code with and without long-term care, assisted living facilities, and nursing homes? Or is that, are the numbers bundled?
Yes, sir. Great question. What's taking us a little longer than we'd hoped is that we're going to try. We will is not trying. We're going to be able to look at what's happening in the most recent week, 2 weeks, which will not include what was done had before. So it's not a cumulative zip code report of all the cases that have been reported to date. It's how many new cases have been reported since May 1st or June 1st and moving forward. It gives you a little better idea of the dynamic and the current situation that that we need to know to have the timely and targeted responses that I think all of y'all well appreciate are necessary. So long-winded, but again, no, sir, it will not be commingled with our prior. Now, one caveat is if we happen to see a large number from a single facility, I will make that point and can account for that. I'll stop there.
Commissioner Overman, you recognize.
Thank you, Chair. As it relates to that, getting the contact tracing to determine the source of infection and the potential spread, as we've gone from on average to 48 cases a day to over 100 cases a day, and a positivity rate from about 2.25 at the starting the reopening, to almost 6%. Are you sufficiently resourced to be able to do effective contact tracing? I mean, we seem to have a lot of unsure of where it came from results at the state level, and I'm not sure if we're adequately staffed for doubling up again should that occur. Dr. Holt?
Yes, yes, ma'am. We are stressed, I'll be frank, and the challenge that we're having is probably going to be on sustainability, particularly if the numbers increase at this rate increases, or even if it falls back, but into a smaller amount, because as I've mentioned, we sort of have cobbled together a team within our existing health department, reassigned them, and the state has given us temporary assets. So we are working on alternate proposals or ways that we can really sustain this, as I anticipate this is going to be months, if not up to a year, of some steady shoe leather epidemiology, which, and I think we've all talked about this, and we do not have, and we have no intentions of using some of the apps and phones and other things. So it really does come down to making a lot of phone calls and reaching out to people. But yes, ma'am, that's something I've tried to look ahead and be prepared, and I'm working that angle as we speak.
I thank you for that, and I know it's not a small job, but is it that understood that the USF team that you've got and your Department of Health are the only sources of contact tracing for those that have tested positive once they're notified? Are we able to work with the hospital staff that are seeing these hospitalizations to determine some contact tracing data? Is the rest of
Yes, ma'am. Our communication with the hospitals is very, very robust. I mean, they're a great partner. When it comes down, when we have access to their medical records documented in their, and we do in many cases, they will document where they believe, or is what is reported by their patients as to where they believe they were infected. But ultimately, we have to validate that by calling the individual themselves, and we use that as secondary sources. The hospitals have, and some of the frontline staff will certainly tell us if they see that, oh, there's been 2 or 3 people that report being exposed, or they believe they were infected at a certain event, location, or situation, and even our community physicians are great partners with that. So you sort of use every piece of information you have. We depend a lot on our community to share with them, share with us their what they're hearing and what they suspect might be going on. Where the hospitals are particularly valuable is in cases where it involves a healthcare worker. I think we've talked about this in long-term care, where they take ownership of all of the potential exposures that happen during their workplace, if you will, their work period. And then we deal with their home exposures as a partnership. So I'll stop there.
Commissioner Overman, this is Andy Ross.
Oh, yeah, I was going to say, I believe we lost Commissioner Miller again. Go ahead, Andy.
Okay, that's okay. Thank you, ma'am. Dr. Holt, I have kind of a question here that this is a little frustrating, I'm sure, for all of us, and probably mostly for you. But at this point, we've had over 3,600 cases, and we're still flying in the fog as far as it seems odd and frustrating that we can't identify anything. That is where these are danger points, whether it's air travel, large groups, hanging around other people that are ill, all these things that anecdotally you would think we would start to see some patterns, particularly now that we have such a large data set of 3,600 cases. And so I'm sure it must be even more frustrating for you if that's the case. But is this elusiveness of this virus, where the inability to find any danger spots or any patterns, is this been true all over the place, or is that just the nature that it's taken here in our region? I don't know. That's kind of a loaded question. I didn't mean it to be, but it's frustrating that with so many cases that doesn't seem to be that any patterns are emerging at all. And that's kind of hard to believe.
Yes, sir. I'll answer that. For our experience, certainly throughout the United States and the statewide, and certainly within our counties and within our state, it's been it's unusual to find large sources of the outbreaks, if you will, that are feeding the outbreak. Other countries have published and talked about identifying this type of source. There's a term called super spreading events. Distinguish that from people. It's not the people, it's the events. And in those situations, most of the time it's been because they have used investigative tools that we don't have access to. Again, a lot of that phone apping, and you can connect a lot of people to an event or to an area that we certainly don't have and won't have. The virus, because it is so insidious, contagious with mild, if any, symptoms, and there is even in certain situations it can be airborne. That's not the normal. That's not a usual way of transmission, but so in other words, you don't necessarily have to be face to face in some circumstances. But again, I'll emphasize that's more the uncommon, but it can happen. So all of these things have come together that sort of outside of the cruise ships, outside of long-term care, outside of church or religious events and some all these, those haven't been able to account for the large, the majority by any stretch of the imagination of our source for our cases. And yes, as an epidemiologist and as somebody who wants to do something about it, it is very frustrating to me that I don't have that answer, sir. I'll stop there.
Thank you, Dr. Holt. I did have one more question, and I see Chair Miller's back.
I'm gonna correct this mess. Don't worry about it. It'll be corrected pretty soon.
Okay.
But go ahead.
Okay. Dr. Holt, thank you and actually thank you, Mayor Ross, for that question, because what I'd like to do is sort of take a look at other communities that are not seeing the kind of increase that we are, to see what methods they put in place to contain the community spread that's occurring. So, for example, and these are anecdotal, so I don't have anything to go on, but I'm fairly certain the data is available. I've spoken with people that are in Connecticut and folks that are in Colorado that are both seeing a decline in they're seeing a decline or a maintenance as we did when we had Safe at Home. So, which is great, except for they are starting to open up their economies. And the difference is they have a variety of different compliance or programs associated with limited but mandated face coverings and social distancing rules that are being actually enforced. So, for example, in Connecticut, they don't have an overall mandate for face coverings, but they do have a mandate for face coverings inside a building. So, for example, you can't smoke in a building. In this case, same sort of approach and had it where you couldn't smoke. You had to wear a mask inside of a building. In Colorado, for example, in several of the communities, they've seen a decline in the spread or a maintenance of the spread numbers because that communities, apparently they have a very high incidence of social distancing compliance, face coverings for all mandatory, for all employees, and then the majority of the communities have actually participated as well. So I would be curious to see if we can reach out to other communities that are having some success in containing it and finding out what their magic has been, other than, and obviously would need to be a similar density of population, so that when you give us the zip code prevalence, we have an understanding of what we might put into place to help contain this if the spread continues. And I'll stop there. Dr. Holt, do you know of data that's being shared among various different communities in terms of methods of containing the spread that you found effective?
The methods that have been shown to be effective have been, I think, pretty well outlined. I think what your question is how are some communities able to promote, encourage, or achieve the actions that have yielded some results, or at least have believed to have yielded some results. That's one of the biggest challenges with this, is kind of that, is this an association or is it truly a cause and effect? What I would like to do is I'll enlist some of my colleagues that we've consulted with before, because they have both the expertise, the connection, and the time through our College of Public Health partners, and see if they could assist me in responding to your request.
Thank you, sir.
Okay, Mayor Lott, you recognize.
Sorry about that.
Okay. I'm sorry, ladies and gentlemen, I got knocked off twice. My IT person's on the way over here now. Where are we on the agenda? Someone help me.
We're at EPG discussion.
Okay, very good. All right, thank you.
No, county attorney update, sorry.
Okay. Ms. Beck, you recognize.
Yes, Chairman Miller and EPG board members, Christine Beck. There have been no new orders or guidance documents issued by the state, and therefore at this time I do not have any update to report or any legal update to report. So I'll leave it at that. Thank you.
Okay, thank you. EPG discussion. Anything, any topic anyone wants to discuss right now at this point? Seeing no hands. Commissioner Overman, you recognize.
And I'll just make this quick because it's not an issue that we're addressing right this second, but we will be addressing it going forward. I'd like for Ms. Snively to bring back to the EPG a plan for opening the schools. The governor has clearly decided to say open the schools, but has left it up to local jurisdictions in order to decide how to best deploy our teachers and our students to return to school. And I think
Commissioner Overman,
yeah,
you're asking that question, and I think Ms. Snyder is going to tell you that the superintendent said today he's waiting for the CDC to give him some more information before he makes that decision. I think that's what Ms. Snyder is going to tell you. Am I correct, Ms. Snively?
Thank you, Chair. Yes, you are correct. And then the one other item I will add to that is pending the CDC input, the superintendent and board have scheduled a workshop on June 23rd at 9 a.m. It is public. It will be webcast and televised to present the current plan for reopening schools to the board for input and feedback from the board and discussion. So that will be on June 23rd. That's next Tuesday from 9 to 11 a.m. in the school board auditorium. And as soon as I have an update from the superintendent and board, I will certainly be happy to bring it back and report to the EPG. Thank you.
excellent. Thank you very much for that. And I was curious if that includes a survey of your teachers and parents and their attitudes towards returning to school.
Through the chair, yes, that does include a survey that was put out to parents, guardians, as well as faculty members. We received the feedback from that survey was presented at the last board meeting on the 9th of June. That is going to be on our school district website very soon. It is out on social media currently. And then results from that survey, along with many other components and factors, will be taken into account for moving forward with a plan to reopen, obviously maintaining some fluidity and being nimble because plans could change. So the plan that will be presented on the 23rd is that day's plan, but that could also change as numbers change and information and data come in. That could possibly change the way schools are reopening. So thank you.
Thank you very much. I appreciate it.
Ms. Snively, did you have your hand up?
That was just to respond. I'll take it down. Thank you.
Okay, thank you. I don't see any more hands at this point. Let me apologize for my problems with my computer. My IT guy is on his way over here now, so we're going to hopefully have this corrected. I won't have this problem again. So seeing no further hands, if there's nothing from the force today, we stand adjourned. Have a great day.
Thank you. Have a great day.
Services. Please enter your conference room number followed by the pound or hash. Conference room number accepted. If you are the organizer, please enter your PIN